Today I'm gonna tell you about fractures. You know I love orthopedics. Orthopedics is the specialty of my heart. So what is a fracture? A fracture is a discontinuity of the bone cortex with involvement of soft tissues. So what are the examples? We have transverse. This one cuts straight across the bone. This one has a horizontal fracture line as shown in the image. Number 2, you have an oblique fracture. This one now is angulated. It cuts the bone in an angle. And number 3, we have spiral. In spiral, fracture line wraps around the bone. It is seen in 3 planes, common in a twisting injury. Laminated fracture. This is now where a bone is broken into multiple segments. It is common in crash injuries. We have a hyaline fracture or stress fracture. This one now, there's a small crack in the bone due to overuse of stress. It's common in athletes. Then we have a closed fracture. This one now, there's a broken bone but the skin is intact. We have open or compound fractures. This one now, the bone is communicating with the outside, which means that the skin has been pierced. So we looked at this when we were classifying open fractures in Gustillo and Anderson classification. Green stick fracture. This is an incomplete fracture common in children. So the fracture bends just like a green stick. Don't confuse this with the torus fracture. Torus fracture occurs as a result of a compressional forces applied on the metaphysis, which is a point of a decreased strength. Green stick fracture occurs in the same mechanism. So now more severe forces are applied, leaving one cortex disrupted and the other one bent like a green stick. Hence the name green stick fracture. Segmental fracture, the same bone is fractured but in at least 2 places. Compressional fracture, now the bone is crushed in this one. It's common in a vertebral disc. There's also burst fracture. The difference between burst fracture and compressional fracture is that in compressional fracture, the anterior aspect of the vertebra is crushed, creating a wedge shape. And in burst fracture, all the direction of the vertebra are crushed. Impacted fracture is another type. This one is similar to torus or buccal fracture. It occurs when broken ends of a bone are jammed together by high impact force, like in accidents or falls from great heights. Linear fracture. This is a break in a bone resembling a thin line without splintering or distortion of a bone. Mostly occurs in skulls. Most of the times is caused by blunt trauma. Linear fracture is different from a fissure. A fissure is simply a small cut in the bone, neither displaced or angulated. It's caused by overuse or secondary to conditions such as osteoporosis. Then there's a displaced and non-displaced fracture. Displaced fracture is one that has lost its normal anatomical position, or it has moved from its normal anatomical position. A non-displaced fracture, on the other hand, is one that, despite being broken, it still maintains its normal anatomical position. And depending on what part of the bone the fracture is, you might name the fracture or classify the fracture as proximal or distal. Let's use the femur for example. So proximal means closer to the trunk or closer to the point of origin, and distal means away from the trunk or away from the point of origin. Let's use the femur for example. A fracture here will be called a proximal femur fracture, and a fracture here will be called a distal femur fracture. So a fracture here will be called a mid-shaft fracture. What about a fracture that occurs between the mid-shaft and the proximal or the distal? If it's the upper part, let's use the femur for example. This part here will be proximal third fracture. What about between the shaft and the distal end? This one will be the distal third fracture. Other types of fractures that are worth mentioning include the avulsion fracture. This type occurs when a small chunk of a bone attached to a tendon or ligament gets pulled away from the main part of the bone. Intra-articular fracture. This is a fracture that occurs and extends into the surface of a joint. Pathological fracture occurs through areas of weakened bone secondary to bone disease like osteoporosis or malignancies like osteosarcoma. Fracture dislocation, fracture that occurs with the dislocation of a joint. You may hear of Galeazzi, Monteja, Essex Lopriceti fracture dislocation. Okay, that is it for now. Now you are in the know. My name is Harry. Consider subscribing to this channel and let me meet you in the next one. Bye bye and thank you.